Good morning, everybody. My name is Dr. Patrick Flynn, and welcome to this morning's A Different Perspective. I am so excited you guys are here today. We're going to have an extremely great time today, and I'm hoping to take you on this mental journey today that's going to lead you somewhere that I've never really taught on much at all, even though it's a topic that I've dealt with for my whole career. But I'm going to give you such a different perspective on this today that I want you to understand that almost you have to wait to the end to get to the topic that we're going to cover today. You say, Doc, what if this takes an hour? I can probably tell you if this takes me an hour, about 45 minutes, we're not going to talk much about hormone replacement therapy or hormone therapy or menopausal therapy. That's what they call it. There's multiple names for it. But you say, well, what do you mean? Well, I have to tell you some of the clinical experiences. I have to tell you some of the evolutions on there. But I believe if you hang on with me to the end on this, you're really going to enjoy my perspective. Because contrary to belief, what they're telling people, this is becoming such a big deal, not from a standpoint of just hormone placement medically. But remember, hormone placement can be done also bioidentically. Hormone placement can be done with a pellet. Hormone placement can be done with a cream. So it doesn't just have to be a medication. It can actually be a medication. It can be the most natural thing on the planet. And that's why I need you to get a couple perspectives, a really different way of thinking before we even get to those uses. So yes, are we going to talk about hormone placement therapy? Yes. Are we going to talk about bioidenticals? Yes, 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 and yes. But the concept is what makes today's perspective very, very clear. So, as you know, I always like to define things and what we do with it. So let's do this. So let's start with just by defining hormone replacement therapy, and then I wanted to walk you through what happened to me young in practice. Because if we look at what happened to me young in practice, next thing you know, I started to take care of women. And obviously, you know, having the language about cyclic women, I had menopausal women come in. And the majority of women today taking some form of hormone replacement therapy or HRT is actually women in their menopausal ages. But it's not everybody. There's women that take hormone replacement actually very young. I'm going to show you a couple examples. But what I do want you to show you is this. Let's define just first of all what Mayo Clinic says about hormone replacement. So hormone therapy, is it right for you? Hormone therapy, here we go, was once routinely used to treat menopausal symptoms and protect long-term health. Then large clinical trials showed health risks. What does this mean? Well, they go through it and here's what happens. Hormone therapy is what? Hormone replacement therapy. Medications contain female hormones to replace the ones the body no longer makes after menopause. So let's do this. Think about the concept it says right there. Every woman and every scientist and every doctor knows that the cyclic levels for the estrogens and progesterone and testosterone, all the anabolic hormones, start to change after menopause. Now, menopause is a time, all right? When you're cyclic, obviously there's a certain age group, and when you're menopausal, there's an age group. But it's interesting how they talk about the medications contain female hormones to replace the ones no longer makes after menopause. Well, just by that statement alone, just understand, you're not supposed to make the same amount compared to cyclic compared to menopausal. Because why? Physiologically, it's not meant to be that way. You're not supposed to have the same estrogen levels at 33 that you are at 63. It's physically impossible unless you're taking something because certain organs change. We all know this. The amount of hormone produced by the ovaries at 33 compared to 63 are dramatically different. Because why? Because there's a different stage of life between cyclic and menopausal. So that thing right there, they say, well, you're no longer making it, so we got to replace it. Well, once again, they're not supposed to be there in the first place. It's sometimes used to treat common menopausal symptoms, including hot flashes and vaginal discomfort. All right, could be vaginal dryness, could be vaginal pain, could be just issues there, swelling, discomfort during sex. So, but let's kind of think about this. Is sometimes used to treat common menopausal symptoms, hot flashes and vaginal discomfort. All right, well, here's the part that I want you guys to understand. So I'm in practice, and I will tell you this is not a joke. I keep on telling you guys this on a regular basis. 90% of the things that I do clinically today, I have never actually learned in school. You say, Dad, you're telling me you didn't learn hormone levels in school? No. You learn hormone levels. You learn, for example, how to measure estrogen, okay? You learn some things that way, but you don't learn hormone levels, all right? So now, let me give you an example. So all of a sudden, I had women in their menopausal ages to come in, and I'm going to show you what roughly the age in the United States, roughly 51 years old. But guess what? Let's just, in the ballpark figure, they're in their 60s, and here's what happened. The women that came in didn't have hot flashes, didn't have vaginal discomfort. And then there are women that came in their 50s or in their 70s and actually had even osteoporosis or osteopenia, actually hard time sleeping, intense hot flashes. Some actually had light hot flashes. I'm like going, oh my goodness, there's a massive array of people doing this. And when I actually started practice in 1999, hormone therapy was given to some, and then someone would come in and say, my doctor won't give it to me at all. So I was basically a little bit confused. So then I started to think about more. So let's keep going a little bit with their definition. Hormone therapy has also been proven to prevent bone loss or reduce fractures in postmenopausal women. Well, there's women that came in with bone density tests of all ages over 51, from 51 to 90 years old, didn't have any bone loss, didn't have any problems. So then it started me thinking about this way. So it's talking about, is hormone therapy right for you? So therefore, they talk about replacing hormones. They talk about menopausal women. Along with the benefits, there are risks associated with using hormone therapy. These risks depend on a few factors, including the type of hormone therapy, the dose, how long medication. For best results, hormone therapy should be tailored to each person and reevaluated every so often to be sure the benefits still outweigh the risks. I was like, whoa, okay. So how do they measure the benefits outweigh the risks? And I started asking, and nobody knew. They just knew that, listen, women are in menopause. Okay, so I said, all right, well, man, this whole menopausal thing that they don't teach you much about in school, I'm going, all right, what's the effects of menopause in the body? So actually, no joke, this is actually recent to tell you the truth. But the information out in menopause a long time ago was honestly really no different today. It's just that you hear the more of the same things. So let me give you an example. So here we go. For some women, menopause can be a welcome stage in their life. Okay, now think about that. I just talked about that. There's some women that are 63 years old, no osteoporosis, no hot flashes, no vaginal dryness, no irritation, no sleep problems, no mood problems. And there's some, it's just hell. It's just, they can barely get through the darn day. All right, so occurring around age 51 on the average. That in the US, it's actually average 51. I've seen other countries, actually in some foreign countries, menopause sometimes is not till 55 to 58. Okay, and I believe there's a reason why. Menopause means that your periods have completely stopped for at least 12 months. Yeah, I can agree with that. In total, menopause can last an average of 7 years. Okay, no joke. This was actually taking something off of Healthline that was published not too long ago. And this is where I started to go, hold the phone. All right, something's not adding up here. In total, menopause can last an average of 7 years. Are they meaning that people are dead 7 years after they start menopause? I know it sounds funny. I know I'm pausing and being a little bit dramatic here, but I want you to think about this. Think about their words that they're listing. In total, menopause can last an average of 7 years. I don't know. My mom's 65 years old, and she's been in menopause over 10 years. Okay, actually, let's say around 15 or so. But here's my point. They don't distinguish what menopause is and the things women go through during a menopausal age. And then it started to click with me. Now watch. Aside from the absence of menstruation, menopause involves a whole host of effects on the body. Some of them can be uncomfortable, hello hot flashes, while others may go unnoticed. Learn exactly how menopause can affect the body as well as the most common things and symptoms. Well, here's the phone. Hold the phone. Here's one thing that they're telling. They're saying mood, sleep problems, insomnia, weight gain, stopping periods, low sex drive, bone density, vaginal dryness, painful sex, urination problems, night sweats, hot flashes. And then, as you know, when I first started, if we go back to the original slide, I pulled up from Mayo Clinic hormone therapy. And they talked about replacing hormone and actually all the symptomatology related to this. But then on a different page of Mayo Clinic's website, I do love this. Now watch something that is quite interesting on this. You see the term menopause. Brandon, can you do me a favor? I don't know if you can see it, but look in the computer. What's right above menopause? Diseases and conditions. Does that mean every woman that reaches the age of 51, stops menstruation, is in a disease and condition state? See, because look at how they even define menopause today. Menopause is a permanent end to menstruation and fertility, defined and occurring 12 months after your last menstrual period. I agree with that. Menopause can happen in your 40s and 50s, but the average age is 51. I can agree with that. All right. Now, here we go. Menopause is a natural biological process. I totally agree with that. But wait. Think about this. It's a natural biological process. So guess what happens? Menopause isn't a condition, isn't a disease process, even though they label it like that. It's actually, if you live long enough and you move from a young lady to a cyclic lady to actually a woman above the age of cyclic, which actually by term is called a menopausal woman, it has nothing to do with what you go through symptomatology-wise. Because you know why? Although it ends fertility, you can stay healthy, vital, and sexual. Let me ask you questions, ladies. The last time that somebody talked about menopause to you, if you're cyclic or if you're even in the menopausal years, are they talking about being healthy, vital, and sexual? No! Women downright fear the process because their mom had osteoporosis. They got cancer during time. They did all these things. And some women feel relieved because there's no need to worry about pregnancy anymore. Now watch this. This actually throws a monkey wrench in everything. So here's what happens. Regardless of your age right now, let's say that you're 35 years old. If you live long enough, that cycle is going to end. The ovaries are going to decrease their production of hormone like it's biologically supposed to be. And they're going to be at a different level. And guess what happens? And then you're going to move into this menopausal stage. And then here's what they say. Even so, the physical and emotional symptoms of menopause are sleep problems and everything we talked about during that last graph. No, it is not. Because herein lies the problem. Are you as confused as I am? Herein lies the problem. What is menopause? What is it? See, if you look at the current level of thinking, guess what? They treat it like a condition and disease. It's even listed like that. Think about it. It's listed as a disease and condition. And so then therefore, when it comes to hormone replacement therapy, what they're doing is they're giving it based on symptomatology and what a woman is going through regardless of her age. Now, and then all of a sudden, guess what? That's when I had my light bulb moment. That's when I was like, everything for HRT, it doesn't matter if it's a bioidentical, it doesn't matter if it's a bioidentical pellet, it doesn't matter if it's a cream, both medical or actually bioidentical. Here's the problem. The problem, once again, menopause is not the problem. It's actually how we look at it. That's the biggest problem. I've always told you guys that what makes all this stuff stick out like a sore thumb is the perspective. So therefore, guess what? When women go through major hormonal problems, and yes, the majority of women, once again, that go through menopause, their hormones actually do go too low. Now you say, Doc, but go too low. I didn't say they went to a normal menopausal level, they go too low. And what do I mean? Let's say, for example, on a lab, that a normal level of estradiol, once again, was 110 to 200, okay? And your level's at 140. And then all of a sudden when you're menopausal, it's between 40 and 50. Well, a lot of times you'll measure a woman and they're at 20, which for example is it went down like it was supposed to, but it went too low. And that's when all the problems start to occur. Menopause, once again, has absolutely nothing to do with any symptomatology. Let me say it again, and that should change your perspective, and then you're going to understand HRT very differently. And I don't care if the HRT, the hormone replacement therapy, the hormone therapy, the menopausal therapy, those are all the names for it when you look it up. I don't care if it's a bioidentical or I don't care if it's a synthetic chemical. The thought process to even lead you to it, to even think that you need it, If you don't understand this concept, it can be a very bad day for you. What do you mean, doc? Well, what happened is because women were going and getting osteoporosis and vaginal dryness and all the different menopausal symptoms they said, listen, we just have to increase the hormone that you lost going through a different stage of your life. But what they found out, and that's where, once again, this comes up a lot, the Women Health Initiative, they did long-term study when it came to the amount of hormone they were giving and the results of it coming out. Now, watch this. The largest women's health prevention study ever. Some of the most common diseases that affect women after menopause are cardiovascular, breast cancer, colorectal cancer, osteoporosis. In 1991, the National Heart, Lung, and Blood Institute launched the Health Initiative. And what they found was this, okay? To reduce the number of women who developed the amount of cancers and everything like that. Now, after the results, they found out by 2002 that postmenopausal women taking combination estrogen, progesterone, hormone therapy for menopausal symptoms had an increased risk of breast cancer, heart disease, stroke, blood clots, and urinary incontinence. So what they were saying was the doctors gave them a prescribed dose of hormone replacement therapy, so a synthetic form. Now, once again, they did talk about this. Just for you guys that are going to say, well, doc, it wasn't bioidentical. It was a synthetic form, and what ended up happening was the rates of all the diseases that women die from on a regular basis went elevated. Now, they found out that they actually had less symptomatology. Okay, so you're saying, see, doc, look at that shows that HRT is bad. That's not really true, even from a medical standpoint. And I say, what are you talking about, doc? You're confusing me. No, follow me on this, because here's what happens. Do you think every woman on that long-term study actually got any disease? Do you think every woman? No. No. See, that's the thing. See, that's why, for example, if you look about what it talks about during the studies and what they did, now watch. So what they did was this. So here's the perspective. They said, listen, we got to give hormone because these women are getting way too low and they're becoming osteoporotic and all these major things that are going on if these hormones are low on women. And so what they did is they started to increase them. And then once again, they found out all the other conditions that came from, but not everybody got those conditions. So what they said, and that's why you see, they say, listen, we're going to get all the experts together. All the experts. So that's what they did. They said, we're going to get all the experts together. And the experts do agree about hormone therapy. What do you think they agree upon? They agree upon everybody should take it. You know? And here's the term that is one of the most misleading terms, and to show you that the thinking is totally off. They always talk about the benefit can outweigh the risk. Anybody that tells you the benefit can outweigh the risk, man, I'm telling you, run. Now you're saying, doc, are you telling these women not to take hormone therapy? That's not what I'm telling you. Because a lot of women are saying, but doc, they're getting away from HRT and actually giving people bioidenticals. What is a bioidentical? Most bioidenticals are a plant-based replacement. Instead of using a synthetic hormone, instead of using a horse hormone, instead of using just a basic chemical, they've moved to more plant-based things. And so people, now once again, people say, well, doc, that identifies better with your body. They're more identical to your real hormones. That is true. But the thinking is this: you can get cancer just as easily from bioidenticals than you can from HRT. Let me say that again. You can get actually cancer just as easily from bioidenticals just as you do HRT, because there's a reason why. Let me explain something. That's why all these experts got together and said, listen, not everybody that gets HRT gets cancer. And they're right. They're right. That's not a joke. And people say, but you're confusing me. No, I'm not. You got to come from their perspective. It's like this. Let me go back to just a basic hormonal thing. Christy's diagnosis, having endometriosis and the things that she had, and advice that doctors gave her, say, listen, if you do not treat these things, your result will probably end up with cancer. Were they right? Yes, from their perspective. But because I came from it from a different perspective, we reversed that process, and guess what? She's the healthiest she could ever possibly be, and she's 43. And that was diagnosis in her early 20s and teens and 20s. So you think about it this way. So all these experts got together and said, listen, having low hormones is not good. It can relate to all those menopausal symptoms, but there's a key. Guys, let me tell you this. Quote me on this, put it in the comments. There is no such thing as menopausal symptoms. Can I say it again? There is no such thing as menopausal symptoms. There's no such thing as perimenopause. There is cycles of life, meaning, let's say you're a little girl, you're cyclic and you're menopausal. If you're perimenopausal, it means you're going through symptoms that you're not supposed to go through. And they don't know what to do with it, so they just consider it a different stage that they can explain that you're just getting close to menopause. No, because in menopause, you can have zero symptoms. Why? But if you do have symptoms during your cyclic, during your non-cyclic years, let's say you're 7 years old, let's say that you have problems when you're menopausal, it's an observation and a telltale sign that your hormones are either too high or something that's very common in menopause, too low. Too low. And so therefore, when they give women hormone replacement, that means in any form, a chemical form, a bioidentical, a cream, an injectable pellet, guess what happens? It doesn't matter, for example, what stage of life you are. If you're deficient, it's going to feel good. I can guarantee right now, some of you women that are taking HRT right now, watch this going, Doc, you understand, it changed my life by taking it. And it's a synthetic chemical. I don't disagree. If you take a synthetic form of fuel to your body's going to use it. And it can do some things better. And there's women on here watching right now say, Doc, I just took a little bit and actually it caused cancer. I agree. I totally agree. Doc, you're losing me. I told you got to hang in with me on this one. Because when you do, the light bulb moment is going to literally rock your world. So here we go. So so all the experts agree in North America that guess what? 10 years have passed since the publication of the Women's Health Initiative trials. The debate that fouled gave women and their providers the impression that the experts don't agree on the topic of hormone therapy. The purpose of this joint statement is to demonstrate that the experts do agree on key points. Number one, hormone therapy is the most effective treatment for menopausal symptoms such as hot flashes and vaginal dryness. If women have only vaginal dryness or discomfort with intercourse, the preferred treatment is low-dose hormone replacement therapy. So if you have just vaginal dryness, give it a little bit of hormone, but you have a bunch more, give more hormone. Okay? I know. And here's what happens. I will tell you. If it's a hormone replacement therapy chemical, now remember, and in this whole thing, they're not talking about bioidenticals, because I know a lot of you bioidentical women are saying this, but Doc, at least the bioidenticals are safe. No, they're not. Now, once again, let me explain why, okay? Now, I can tell you honestly, you could probably use HRT, bioidentical pellets, cream, and all be healthy once you get the concept, once I go on a little bit farther. But see, all the medical experts say, listen, this is still the number one form of treatment. Why? Because they don't know what to do. Can I say that again? They still agree upon something that actually has been shown to cause a lot of cancers because they still don't know what to do. Do you understand this, ladies? With all the technology that we have out there in the trillions, we don't spend billions on healthcare, we spend trillions. Think of it this way, 3 to 5 roughly $1 trillion, I think it's roughly in between there, we spend on healthcare. And you're telling me that after even showing that these things can initiate cancer, they still tell you it's the best form of therapy. We need to change the perspective on this. What else? Hot flashes generally require a higher dose of estrogen therapy. Women who have had their uterus removed can take estrogen alone. See, so all they just say is, well, the benefits outweigh the risks. And then women are left with a conundrum of going, what do I do? Well, let's go on this is the same thing. Here's the risk they talk about. Both estrogen and therapies and estrogen with progesterone therapies increase risk of blood clots in legs, lungs, similar to birth control patches and rings. Hold the phone. People don't realize. People say, Doc, I've never taken hormone replacement therapy. Yes, you have. It's called birth control. And that's why, just like with hormone replacement therapy, if it makes your hormone levels abnormal, it can end up with blood clots in legs and problems in your lungs. Similar to birth control. Ladies, let me tell you this. Please do not disrupt your hormonal system like this. You're setting yourself up for the stages of menopause that are not going to be great by taking birth controls. Now, an increased risk of breast cancer is seen with 5 or more years of continuous estrogen therapy. I do love this one though, okay? they talk about additional information, and they say, well, the Food and Drug Administration say this, and there are many options to hormone therapy that are approved and chemically but identical to your body's own hormones. And see, this one's where it's misleading when it comes to bioidenticals. Let me show you something. There are many options for hormone therapy approved by the FDA that are biochemically identical to the body's own hormones. We don't have scientific proof that custom compounds bioidentical therapy is any safer or more effective than FDA-approved hormone therapies. Many medical organizations and societies agree in recommending against the use of custom bioidentical hormone therapies for menopause management, particularly given concerns regarding content, purity, safety, labeling, and compound hormone therapy. Okay, so Doc, you kind of made me mad because you said some bad things about bioidentical therapy. Well, let me explain this. I'm not against bioidentical therapy. I never have been, I never will be. I can honestly tell you that, ladies, let me say something that no doctor has ever told you before it was done. If you have a full hysterectomy, what does that mean? Both ovaries and uterus gone. You will have to be on a bioidentical the rest of your life. But I haven't gotten to the key point yet. I haven't gotten to the aha moment that's going to actually blow your minds away. So that's why when women come to you and say, Doc, I take HRT, I'm too scared to get off because, man, it just changed my life. I don't disagree. I'm trying to tell you that HRT, bioidenticals, pellets, creams, everything, chemical or bioidentical or the closest thing to our identical hormones, once again, can actually change any symptom if you're deficient. But I'm going to show you where the missing link comes in to why that if you're not having the proper testing done, you can take HRT, which is actually a little bit more potent at causing some estrogen problems than bioidenticals, but bioidenticals can cause just as much cancer as HRT itself. So now, there is lack of safety data supporting the use of hormone therapy in women who have had breast cancer. That's true, because they don't like to experiment with a only known cause of breast cancer is estrogens getting out of control, and there's the key. But so they say they don't study it. Non-hormonal therapy should be the first approach in managing menopause symptoms in breast cancer survivors. What do they mean by non-hormonal therapy? Anything that changes their symptoms, from opiates to anything that way. Because, once again, under condition management. All right, now watch this. This is where, even to this day, they will never get it. They say, Doc, you're being pretty bold. Oh, I'm going to prove it to you in less than a couple slides. So here we go. Still on the same website where all the experts agree. Here we go. Bottom line. I love that when people say, the fact is, and bottom line. I'm like going, all right, here comes some just emotional things that they're going to try to justify why they believe something they believe. See, man, be careful and see. The fact is, bottom line. I'm like going, all right, let's see what they say. Here we go. Hormone therapy is an acceptable option for the relatively young up to age 59 or within 10 years of menopause. Who said so? The experts. What's an expert? I mean, sincerely, what's an expert? Because I'll debate every expert on this issue, and I will prove it to you within the next 10 minutes that all the experts actually are clueless, and they're wrong. I know, I told you, it's going to be an interesting topic today, because I have to say that, because you know why? Guess what happens? A lot of doctors won't give estrogen therapy. A lot of doctors will. They have conflicting opinions. But either way, they just give it or not based on their thinking, but they don't follow up and understand why the woman that did take hormone replacement therapy or took a bioidentical or a pellet or a cream ended up with cancer or didn't end up with cancer. I'm going to show you the exact reason why they do. All right? So now, within 10 years of menopause, and I highlighted healthy women who are bothered by moderate to severe menopause symptoms. So let me read this continuously so you can understand. Hormone therapy is an acceptable option for a relatively young and healthy women who are bothered by moderate to severe menopausal symptoms. Let me say this, in experts, you are wrong. There is no such thing as a healthy woman that has moderate to severe menopausal symptoms. See, the perspective of all experts in medicine is that if you actually, once again, don't have some form of pathology, some form of disease, some sort of cancer, heart disease, that you're a healthy individual. I've actually had women say, Doc, if I didn't have cancer, I was pretty healthy. I've had women actually smoke and actually end up with lung cancer and say, besides, this, I was pretty healthy. Because there is the thing, they're so pathologically, they're so diseased, as my example, fire department carpenter, they're so fire oriented, they actually say this. Healthy women who are bothered by moderate or severe symptoms, in order to have a moderate, a mild, or severe menopausal symptom, you have to have hormone levels that are too high or too low. Now let's step back a little bit. If your hormone levels are too high or too low, the messengers, because that's what hormones are, they're messengers, are not doing what they're supposed to do, and there's going to be some sort of the body that is not biochemically and physiologically working the way it was meant to. See, their concept of healthy or unhealthy is ridiculous. Their concept of what to give a woman for her hormones is actually ludicrous. Because why? I'll show you. There we go. Individualizing is the key in the decision to use hormone therapy. I agree with something finally on this whole page. Consideration should be given to a woman's quality of life priorities as well as her personal risk factors as age, time since menopause, and a risk of blood clots, heart disease, stroke, and breast cancer. See, they're going to actually look and go, well, if your mom had some of these things, you can't have this. Or, well, does the benefit, and that they talk about all the time, does the benefit outweigh the risk? Medical organizations devoted to care of menopausal women agree that there is no question that hormone therapy has an important role in managing symptoms for healthy women. I mean, think about the oxymoron there. Do you see what I'm saying? Think about managing symptoms of healthy women during the menopausal transition and in early menopause. Ongoing research will continue to provide more information as we... Do you understand? If you pour money into a bad idea, you still can come up with bad results. That's what we've been doing in medical research forever. Because medical research isn't based on physiology. If it was, no one's going to make money. Do you want me to say it again? There's no money in research in physiology. None. Everything is based on what can I create to change these things so people don't suffer because I know that we can give it to them the rest of their life. Period. And so it's frustrating. It's totally frustrating. Now, let's do this. So let's move into a little bit of a, here's the problem. Okay, here it is. They don't know what healthy hormones are. They don't. I'm going to show you. I'm going to show you the aspect of how even a chemical could do them better. Isn't that funny? Because why? Because it's based on some major concepts that I'm going to show you that are so physiologically sound that no living scientist, doctor, any individual that understands this whatsoever, and I'm going to show you in the next 15 minutes how you will be more educated on hormones and what can be done than every expert on North American panel. Oh, that's a pretty big challenge, isn't it? Yes, let me show you. Here we go. So let's take this woman. If you look, for example, if you've seen a Dutch test before, as you know, I like to run Dutch and blood together that way. And once again, just to give you an example, I always tell women, I have no ties to my labs. I used to use a lab before Dutch. Dutch just came out a better way of doing it, but Genova does a good job. I used Genova before and everything. So I always want to make you guys know that I have no ties to these companies. I'm trying to get you the best evaluation, because remember what an exam is? An exam, for example, is a doctor's observation to what your body is doing. What is it doing? How is it adapting to everything? So watch this. So here's a woman that, for example, if you notice, go back to it. Once again, the little purple area here is the menopausal range. This is a cyclic range. And look at, in DHEA and testosterone, there is no cyclic or menopausal range. They're the same. What? You're telling me DHEA and testosterone are the same from when you're cyclic or menopause? Yes, they are. So that's why if you look, this woman's tanked out low. Even within the menopausal ranges, her, for example, is extremely low. Uh-oh. But guess what? Estrogens. Now remember, here's the key. Here's the key. When you look at estrogens, it's more than one hormone. That's the part that I know sounds so simple, but when I started teaching that there was more than one estrogen 20 years ago, women will be, their minds blown away. Here, so for some of you guys that have done this, can you do me a favor and can you message me about this? Do me a favor. I want you, since you're going to be at Christmas this next coming weeks, can you do a great experiment for me? And actually, if you can, post it on my Facebook and let me know. I want you to walk up to your mother, your grandmother, your aunt, your niece, and ask them this question. Miss Jones or Martha or Agnes or Jennifer, trying to come up with all the different raised names, or Claire or Rebecca or Elizabeth or Cynthia. Here we go. Is estrogen a hormone? Is estrogen a hormone? I do this at my hormone seminars all over the world, which I'm going to be, it's kind of cool, overseas next year. And what does every person say? Do me a favor. Please do this, humor me, but do it for your own thinking. Is estrogen a hormone? Every woman is going to say yes. Every man's going to say yes. It's not a hormone. Estrogen is not a hormone. Can I say that again? Estrogen is not a hormone. Estrogen is a term that describes multiple hormones. Do you see what I'm saying? So if estrogen is just a term, then there's multiple hormones. Well, what happens with those hormones? Those hormones convert into different estrogens in the body. And those levels of those estrogens determine what happens to tissues. So for example, guess what? Some of her estrogens were actually really low, but one was actually significantly high. And this was her 4-hydroxyestrone. Now also her estradiol. So actually there's two. But I want to show you something. We did the Dutch, but we also did the blood. Now, why did we do the blood? Because here's what happens. Oh, let me see it. There was that one, that 4-hydroxy was elevated. Okay? But let's do this. As we see this conversion happening, so the estrogen's converting to different forms, that one was really elevated. Now, the one thing about this one right here that's really elevated, hold the phone, estrogen metabolism and breast cancer. See, when they talk about estrogen causes breast cancer, they're actually misleading you. There's certain estrogen levels that are extremely protective to all tissues, including breasts and uterus and ovaries. Hold the phone. Then why is it that they give us an estrogen blocker, an aromatase inhibitor, if you have cancer? Because they say we can't selectively decrease the ones that actually can cause metastasis and growth if they're elevated. So we're going to stop them all. Now, let's flip that around. Let's say they're too low. It doesn't matter if it's HRT, a synthetic chemical. It doesn't matter if it's bioidentical plant-based. It doesn't matter if it's a pellet plant-based. It doesn't matter if it's cream, bioidentical, or actual chemical. If you don't understand the conversions and where they go, guess what happens? They can be converting into the form it's not supposed to, and now it can lead to cancer. Let me go back here. That means if someone gives you DHEA and these things convert down, or somebody gives you one of the primary estrogens like estrone or estradiol, and this pathways are off. Let's say this pathway is not working, this one is, and this one isn't, and all the hormone converts into the one estrogen or two or three that can, if it gets elevated, can cause cancer. That's why, guess what? Someone could take HRT and get cancer. But if that pathway, the ones that are metastasizing into the tissue that makes it grow out of control, if that pathway is fine, and the other pathways, guess what, are good, you can take hormone replacement therapy and never get cancer. You can even feel better. You can be sitting here right now and say, Doc, that's me, I take it, I feel good, life is good, nothing's wrong. And then you have another woman said, you need to get off of that because you have no idea how it just destroyed my life. And then you have a yelling match explaining that, guess what, HRT destroyed me, HRT is good, HRT, and this is the battle. But I'm telling you right now, here's what happens. If this was a bioidentical, a plant-based one, if it was taken orally, applied vaginally, taken by a pellet, cream, doesn't matter. If the conversion to the metastasizing growth actually goes elevated, if a bioidentical cause this is to go up, guess what happens? Cancer. Now, if this pathway is protected and good, and you take the hormone, and all these things stay in a normal level because they metabolize, they convert properly in the liver, they convert properly in the fat tissue, they convert properly, guess what happens? You can take a bioidentical safely, you can take HRT safely, you can take any form from a pellet, cream, anything like that, and guess what happens? life is good. Life is good. But if this metabolism, what does metabolism mean? It means convert from one form to another. Somebody do me a favor. If you asked, for example, your female relatives during Christmas, is estrogen a hormone? And they say yes. Say, find it to me on Google. Grab your phone and find it to me. And they cannot find it. And say, now can you tell me, now that you know that estrogens, for example, actually are produced within some of the organs. What are those organs? The ovaries, the adrenals, the fat tissue. And if they are not metabolized properly, which means directed into the proper form from broken down from one form to another, if it's not broken down from estrone into 2-methyl, if it's not, and it goes to 4-hydroxy, it's a bad day. And then if they add hormone in there, it's a really bad day. And bioidenticals, HRT, or any form of hormone is going to lead you to be wearing a pink ribbon someday with every form of cancer. Yet, let me show you something. Let me show you a different thing. Now, let's take this person. Progesterone. Now, once again, this is the blood. So we like to do the combination of everything. Why? Because blood only measures certain hormones. See, so what I did was this. So I'm young, so imagine this. So people say, Doc, but my doctor measured my hormones. Okay, here we go. Doc, let's measure my hormones. Cool, they run a blood test. You cannot get all your hormones from a blood test. Believe it or not, you can't get all of your hormones from a urine test. And so I sat back at 24 years old and said, the testing that they're doing is incomplete. It's incomplete. So therefore, how can I assess a menopausal woman? How can I assess a cyclic woman? How can I assess a 10-year-old? Because once again, some of those levels are the same all the way through their life. If I don't have the proper testing. Current healthcare thinking of all experts, their testing is dramatically incomplete. Please quote me on that in the comments. All the experts, their testing is dramatically incomplete. So therefore, debating about HRT, debating about bioidenticals, debating about pellets, debating about creams, debating about anything that you do hormonally, if you don't get a complete assessment and understand the metabolism and where it's going and is our body putting them where they belong and actually at the forms they're supposed to be at, it doesn't matter what you use for hormone replacement therapy. See, that's the thinking. That right there will change your life forever. So when a woman came in and actually had no symptoms, I look going, wow, all those levels actually converted nice. Then all of a sudden I had a woman that was the same exact age. So if I had two 63-year-olds and one woman was going through hell and one woman was going, it's just my genetics. No, it's not. My grandma didn't have it. Oh, you say, I hear it all the time. Well, my mom went through bad menopause. No, it doesn't come from your mother. It doesn't come from your grandma. It doesn't come from your aunt. Okay? But what happened was this. Same age, both in the menopausal years. Why is it that that's so dramatically different? Because they had no idea what their hormone metabolism was doing at all. So therefore, guess what? Here, this woman, even on blood work, was extremely deficient. Once again, then we ran the Dutch. Oh my goodness. Once again, levels were what? Were kind of low. Vaginal dryness, hot flashes, tired all the time, no sex drive. How old do you think this woman was? You say, Doc, was she 63? Doc, was she actually 40? Guess what? She was 33 years old. So she's going through all these menopausal symptoms at 33 years old. But they won't call them menopausal symptoms because she still has a cycle. So they define these as PMS. Ladies and gentlemen, guess what? PMS is not normal. It's just common. It's common because they don't think like this. They don't understand hormone metabolism. They don't understand the organs that convert those. And so therefore, if you have PMS, your rate of menopause, so if you have problems at 33, let's say this woman goes through a transition and she's already low at 33 with hormones, and then she goes into menopause, what do you think she's gonna be like? Hell. It's going to destroy her life. Physically, mentally, psychologically, bone density, fat tissue, everything. And so someone's going to come along and say, don't take HRT. It can be poisonous. So let's do bioidentical. Let me go back here. The one level that was normal was one of the major one that causes breast cancer. So if even right now, watch this, even if we gave her a bioidentical to get those up to a cyclic level, this pathway is working really fine. That hormone metabolism right there is going too high. You could give her actually breast cancer at a young age just from a bioidentical. Don't even talk about HRT. And she's 33. And so I watch nowadays women going on birth controls, women going on bioidenticals at young ages, and they've never had a proper assessment to see where all these things are going to go. And guess what happens? It doesn't matter what form of HRT, it's going to be a bad day for this woman. But thank God she came here. Thank God she actually searched out and had family members that actually went through health problems and recovered because of the thinking that we do at the Wellness Way. Now, it gets better. She's 33 years old. Now let me give you another example. Here we go. Watch this. Here's a woman that, once again, she's in her menopausal years, okay? I think she's 61. Now, what they did is they gave her hormones. And she's like, Doc, it changed my life. It was amazing. Yeah? 2 years later, guess what she got? Breast cancer. 2 years later. She was 59 when she went on hormones. I think she's 61 now. She might be 60. This patient's been here for a while. She's doing wonderful. That's another story. But she got cancer. Doc, what HRT did they give her? They didn't. They gave her a bioidentical pellet. They gave her a bioidentical pellet. Now, once again, if it would have been HRT, a synthetic chemical, it would have done the same exact thing. Do you know why? When she took the pellet, she felt amazing because they brought her estrogen levels, so the estrone, up into normal cyclic realms. So she felt great. She's like, Doc, that pellet changed my life. Yeah, it did. But because they never assessed how this whole thing was converting and metabolizing in all the organs, guess what happened? Do you notice I do this when I say metabolism, Brandon? I always talk about this. Do you know why? Metabolism, A to B, B to C, C to D. It's a pathway. And I became a pathway expert. That's right. I actually understand these pathways intensely. I dedicated my life to it because you know why? I had pathways in my wife's uterus on these hormone conversions that were not doing what they're supposed to doing, and it was destroying her life in her early 20s and even in her teen years that way. What would have been her life if we did not get the assessment? What's your life like? What's the life going to be of your family members? You know, I can tell you already, 1 out of 3 women end up with some form of breast cancer. I already know them. See, I don't care what your hormone replacement therapy, your menopausal therapy, your hormone therapy is. I don't care if it's bioidentical, chemical. I don't care if it's pellet. I don't care if it's cream. Did you see I'm repeating myself? A lot of people wanted to say, Doc, I want you to justify bioidenticals over HRT. It doesn't matter what form it is. It doesn't. Now, people will say, well, Doc, if you do have a full hysterectomy, would you agree with me that using a bioidentical is a safer realm than HRT? Yes, it is. So let's give that. It is. I put women on bioidenticals when they have full hysterectomies, and I wish they would tell you that you need some form of hormone the rest of your life. But because they don't know how this all works, they don't know how to take care of it, they just leave you high and dry. Ladies, there's some of you guys right now watching this that said, Doc, my doc won't put me on hormone therapy, and I thank him because it causes cancer. Yes, but guess what? You're ending up with all the other problems, not high hormones that lead to cancer, low hormones that lead to all the other host of problems because the experts still don't know what they're doing when it comes to hormones. And who's suffering? You guys. Well, Doc, I see an integrative doctor. So they use natural things, yeah? Here's one of Nicole's patients that came in that they gave them bioidenticals, and we can map out the whole cycle, okay? We can map out the whole cycle for a cyclic woman. See what I'm saying? See, because hormone replacement therapy is done more than just on menopausal women. And this is the whole cycle based on the course of the 30-day cycle. See these black dots? Those are supposed to be in the cycle, but they're so elevated, they're so off the charts, they're causing a lot of problems with this woman. And they had no idea that, guess what? She started to actually feel better, but it led to other health problems. See, now if this was done right, if this was mapped out right, if this was tested properly and done everything, guess what happens? You know what to do. But that's my point. HRT can be done very safely. HRT, and I would tell you this, I personally, and this is my personal opinion, I will never recommend synthetic hormone replacement therapy. You know why? It is a synthetic chemical. But I do believe that, once again, that bioidenticals are needed in a lot of situations. And if the full proper assessment is done, then guess what? It can be done very safely and very effectively and monitored properly. And a woman, even if they've had their ovaries removed because of some major problem that they need to have removed. See, I'm not saying that women sometimes don't need full hysterectomies. I'm saying the fact that I've seen cancers that if they didn't remove their ovaries when they first came in, I said, you got to get those removed, otherwise it's going to spread the rest of your body, it's going to kill you. So you need to get it taken out. But there's consequences of that. You're going to have to take something the rest of your life. But see, that's not sat down and explained to women before that. So they're like, once again, sometimes left high and dry and suffering. Now, you say, Doc, but you know something? You know what I'm going to do? I still have my ovaries. I just have a little bit of problems. So instead of using bioidenticals, I'm going to use flax and soy. Oh, and I hear this all the time. It's a weak phytoestrogen. Can somebody tell me what that means? You can't. There's no such thing as a weak phytoestrogen. Let me say it again, so people can stop saying things that are lies. There is no such thing as a weak phytoestrogen. Let me explain. Estriol, estradiol, and estrone. So let's talk about E1, E2, E3. So estrone, which is the dominant major hormone in menopause. Estradiol, which is the dominant major estrogen during cyclic years. And estriol, once again, is actually E3, which is actually they consider a weak estrogen, but it's not weak. What it does is these have a higher rate of metastasizing cells than estriol. But it doesn't mean it's weak, because you know why? Estriol can convert into estradiol. So if you take soy and it converts into estriol in your body can take it and convert it right into something that is very, very highly metastasizing. So it's so concept that all these integrative doctors saying flax and actually soy is okay because it's a weak phytoestrogen. If you don't understand how things convert, there's no such thing as one estrogen in a weak form. It can convert into a highly metastasizing. That's why you'll see conflicting experts on soy. Soy is good, soy is bad. No. Soy will determine what happens to your body based on your conversions and your metabolites. Flax, there's some women say, Doc, flax changed my life. There's some women that flax actually induced cancer. So this whole concept of weak estrogens and strong estrogens and good estrogens and bad estrogens, guess what happens? Your body needs certain level of estrogens at certain levels the rest of your life. There is no bad estrogens. I love it when I hear people say bad estrogens and good estrogens. There's no such thing as bad and good estrogens. That's like saying there's bad and good cholesterol. There's no such thing. Do you understand? That's why I just get so frustrated. I know today I'm usually very uplifting, but women are suffering. Men are suffering because they say good and bad cholesterol. Stop perpetuating the perspective that's leading people down the wrong path. Ladies, you don't have to eat soy or flax. Let me tell you something. There's so many other things that you can do. But Doc, I eat them and I feel better. That means you have problems. That means you have problems. That means you have been under the care of a doctor that has no idea what to do about your hormonal system. And anybody that says do soy or flax because it's weak estrogens does not understand the hormonal system. And give them this video. Please do me a favor. Like and share this thing. Share this with somebody that says there's weak and actually strong estrogens. There's no such thing. See, they say they're weak because they don't metastasize cells as quickly. That doesn't mean it's weak. It does exactly what it's supposed to do to that tissue. But here's what happens. Even what they call weak estrogen can convert into a strong one based on the metabolism that way. And unless you're tested, you better be very careful about eating soy or flax, because they can do some damage just as much as a bioidentical, just as much as a pellet, just as much as a cream, just as much as a synthetic HRT. So, I hope I gave you a different perspective on this, on HRT. I hope, for example, that, listen, please do me a favor. When you look at these things getting tested properly, that's the key. Okay? Now, everybody always tells me, Doc, please give me some action steps. Number one, understand menopause is not a disease. If you understand that, that'll change your life. It's not a disease. It's not a condition. It's actually a normal aspect of life. And if you are going through symptomatology, hormones are either high or too low. High or too low. Second of all, get your pathways tested. I just showed you that. I just intensely understood why women go through certain things and some don't. Why when some eat flax and get problems and some don't. Why people take HRT and gets problems, some don't. Why I take about all those things. It answers all the questions that the experts are still confused about. Because you know why? They're looking at it from the wrong perspective. You say, Doc, those are strong words. Okay. Do you see more or less pink ribbons? Do we need more awareness about breast cancer? Or do we need to think differently about breast cancer? Let me say it again. Do we need more pink ribbons and more awareness of breast cancer? Or do we need a different approach, a different thinking, a different perspective on breast cancer? I just answered breast cancer and a whole host of other hormone-based cancers just from a couple slides. HRT, man, this is a cancer talk also. So when you look at this, eat cruciferous. You know why? Helps a bunch of those pathways that actually make those estrogen metabolize. Keep away from your sugars, guys. Doc, you should have done this after the new year. Nope. Guess what? You can actually convert all those hormones from testosterone, DHA, into estrogens that can actually lead to a bunch of those problems. What else? Avoid soy and flax. I just don't like it. I don't like it unless you've been tested properly. See, I have no problem telling somebody to eat flax as long as they're tested properly. I just don't like soy at all. I just think avoid it at every turn because the majority of soy is GMO, and GMOs are destructive for your body. If you haven't seen my video on GMO, please do that. See, so I want you to understand, like I tell people, you need to stop listening and start learning because what I taught you here will get you to think differently. That's always my objective on everything that the Wellness Way stands for. Everything. I'm going to go over to Europe next year and I'm going to blow their mind away. Why? Because over in Europe, guess what? The majority of countries I'm going to, they have socialized medicine. Other people pay for their health care and they're just as sick. They're just as sick. So when someone tells you that what you need is someone else to pay for your health care because it's so expensive, it's not. What you need is to think differently so you don't end up needing their form of health care. No matter if you pay it by private insurance or if you pay it by socialized medicine. Either way, the thinking still perpetuates in us in the wrong direction. Because heart disease, cancer, diabetes, infertility, obesity, type 1 and type 2 diabetes are at record highs, yet we spend more money than ever in history. I hope you want to change, because I do. I will continue to do videos, but I can't do it without you. Can you please do me a favor? Can you like and share this? Please share it if I ever asked you. I never asked you guys for much, but can you please do this? I believe this video will change millions of lives, but I only can get to so many people and if I don't have you. Now, on the flip side, as you guys know, we are having an awesome female summit that relates to personal, that relates to healthcare, that relates to everything with great lady speakers that are coming in. And we're doing a giveaway where people get to live with me for a weekend. With me, my bride, my kids, and also some of the Wellness Way female docs from all over the country are staying right at my house. We're having a great event. And if you put a mountain picture, a little picture of mountain, because once again, that's a symbol for the Wellness Way Women's Summit, you get to go in a drawing. And on February 1st, I'm going to draw and pay, and if you live and pay for a person and a friend, a female friend, to fly to Green Bay, get picked up by us, live life with us on Friday, Saturday, and Sunday. And guess what? go to a beautiful summit, have a VIP party at my house on Saturday night. You can check out all this stuff. You can check out my wife's hormone labs. You can check out my daughter's hormones labs. You can check out our food. You can check out everything. Because you know why? Because I share a different perspective with you. But if you're one of my 4 daughters, this is the normal perspective. This is how they grew up. And this is why my 4 beautiful daughters are vibrant. This is why they actually live a healthier life than most children out there that are dealing with, now I'm gonna say all children out there that are dealing with massive chronic illness and all these problems. And I wanna show you that this can be done. I'm living proof it can. So, and we can repeat this over and over again if people get this message. So I ask you again, please do me a favor. Please share it. That's the only thing I ever ask. Please share it. On that note, my name is Dr. Patrick Flynn. Thank you so much for watching A Different Perspective. God bless. Have a beautiful day. Hey, thank you for watching. Make sure to subscribe to this channel so you don't miss a single video or live stream. Also, share this video with a friend. Once again, thank you for watching.